Generally, when we talk about bulk, we are referring to the formulated product prior to filling. The bulk can be sterilized by heat, by filtration, or in some cases by radiation, but that's rare. Terminal sterilization, as the name implies, is the sterilization of the product at the last stage of processing. The regulations around parentals prefer products to be terminally sterilized, as there's no further processing after this before being administered to the patient, and gives the highest sterility assurance. However, many products cannot be terminally sterilized due to their susceptibility to being exposed to heat. A vaccine is an example of such a product. Well, again, you could use radiation, but that's, again, very rare. Products that tend not to be happy to be radiated. Yes, small molecules terminal sterilization in an autoclave is often used with blow-fill-seal products, but you have to be very careful about the polymer that you choose. LDPE doesn't like that sort of heat. Sterilizing the bulk with heat is generally done by heating the jacket of the vessel with steam and taking it up to a temperature that deems the product sterile. Filtration, on the other hand, is a filter that's between the product, the bulk, and the filling machine and takes out any microbial particles in the product being filtered. Yes, generally the sterilization is always done at the site of the manufacturing. It's the most efficient way to operate, having it in line between the bulk tank and the filling machine. Terminal sterilization can be done off-site and is a separate, unique operation.